On COVID-19 updates and more, today the Biden administration sought to ramp up its pandemic response following the detection of the Omicron variant this week in the United States, something that is concerning the entire global medical community the most right now. President Biden laid out a comprehensive strategy vowing to fight this new variant with the potential of a winter surge. The strategy includes hundreds of vaccination sites across the nation, booster shots for adults, stricter international travel requirements, and free at-home tests covered by private insurance. The president also said that the U.S. Department of Health and Human Services, along with pharmacy companies, will now launch a public informational educational campaign to encourage vaccinations and boosters. In order to do so, the administration would now launch hundreds of family vaccination clinics nationwide for all eligible adults and children. More on this, earlier today we spoke with ITV Gold's health expert Dr. Purvi Parikh. Here is Dr. Parikh. Dr. Purvi Parikh, welcome to ITV Gold. I hope you're doing well today.
Yeah, thank you. Thanks for having me.
Of course, we have to have you. You are our health expert and we have been missing you on the network, so let's go right into it. Dr. Parikh, my first question to you has to be about the Omicron variant. There have been already 2 cases detected as of filming this interview right now in the United States. There have been several cases detected across the world in more than 24 countries. So my first question to you has to be, how worried are you about this Omicron variant and how worried should we be about this variant?
Yeah, that's a question I've been getting a lot in the last week or two. So this variant is a variant of concern because it has the most mutations that we've seen on that spike protein of the virus. And that's the reason why this is so worrisome, is because this is the thing that all of our current vaccines target, in helping us make immunity. But that being said, that doesn't mean our current vaccines won't work or don't work. We're going to find that out in the next few days. And we already have some good news or reassuring data coming out of Israel saying that the vaccines actually do show that they're holding up against the Omicron variant even better than people who had just natural infection. So they're urging people, if they haven't been vaccinated, even if they got COVID, to still get the vaccine. So that's good news, but it is still worrisome because this is a significant mutation. We might need to change something with the vaccines. That's why all of the vaccine companies are studying how well it works, if that vaccine has to be changed or updated. But this is just a reminder as we head into winter, where there's more cold, flu, all viruses, that we have to be more careful. So if you're someone who has gotten relaxed about masking, I would start masking again, especially indoors, in crowded places, public places. Do the hand washing, the distancing. Those simple things actually go a very long way.
Right. And you mentioned mutations, and I have this number written down. It's about 50 mutations of the virus that this Omicron is showing. Doctor, what does that mean? Could you explain it further to us? And how dangerous could that be when you see so many mutations?
Yeah, I mean, mutations themselves are not worrisome or dangerous. It's actually normal for that to happen with any virus because that's how the virus survives. It keeps mutating. And sometimes the virus mutates and gets weaker, but sometimes it can mutate and become stronger, or become more contagious or more transmissible, or, the worst case scenario, which we're all worried about, is that our current vaccines and other therapeutics won't work against it. So that's why we don't want the virus to become so unrecognizable that our own immune systems are not able to fight it off. I mean, that's how this pandemic started in the first place.
Right, for sure. And, Dr. Anthony Fauci has said, doctor, that he needs at least 2 weeks or 2 to 3 weeks to really figure out the impact of Omicron on coronavirus, on the vaccine. Why do they need at least that much time?
Yeah, the reason is that, usually for this coronavirus and COVID in general, the incubation period, what we say, is 2 to 14 days. So someone you may have come in contact with last week or 3 days ago, you may just be starting to feel sick now, let's say, if they had the virus or this variant. So that's why we really need a full 2 weeks to see how much the spread actually is. Yeah. We can't tell from these isolated cases. The other reason is we want to see how well the vaccines work. So all the companies are testing blood from vaccinated patients against this variant. And that will take time too, because, our immune systems take time to make those antibodies to jump into action, even if we've been vaccinated. So that will take some time too, because we're not only going to study the antibody response to this new variant, but also to see if our other immune cells are also waking up and turning on and getting ready to fight the virus too. And all of that takes time.
Yes, definitely. And we need that time. Just hope that things don't go too bad during that time period.
Right.
This patient that is in California, Dr. Fauci said that the patient is doing well. The symptoms have been mild. And we have the news that the patient had their 2 vaccines, but they didn't have the booster.
Right.
Do you think because of the vaccine is the reason that the symptoms have been mild and not severe? And how important do you think the booster dose becomes for all of us then?
Yeah, absolutely. I think the vaccine for sure likely made this case milder in this individual, because even though it's a different variant, the immune system still recognizes it, right, as some form of a coronavirus. And so it has that army reserve to fight it off so it doesn't become severe. But that being said, hopefully it's also good news that the virus, this new variant, is not more dangerous, that hopefully it's weakening. We don't know. This is all information that's still coming to us. So the vaccination absolutely helps. And I think the milder forms are, in individuals that are vaccinated versus not. So again, it's very important. And the booster, I think, will also be important, because, we do know that some of the immunity may wane after 8 months, especially for severe disease. So we want to make sure that especially for mild and moderate disease. So we want to make sure that if you're due for a booster, that you get it, so that we prevent you from developing severe diseases with this variant, because we don't know how much more quickly it spreads or how much more dangerous or virulent it is yet.